Arthritis treatment. Arthritis symptoms can appear depending on lifestyle habits. In particular, degenerative. Arthritis is more likely to occur due to damage to bones and ligaments as we age, so prevention is most important. In this lesson, we will learn about foods that are good for arthritis and foods that are bad to avoid. The first food that is good for arthritis is extra virgin olive oil. Extra virgin olive oil is rich in unsaturated fatty acids that are good for heart health, and it is also rich in oleocanthal, an anti-inflammatory ingredient similar to non-steroidal anti-inflammatory drugs, so it is said to be good for joint health. The second is garlic, a common name for onions. According to several studies, people who regularly consume garlic and onions have been shown to have fewer early symptoms of degenerative arthritis than those who do not. This is because the contained anti-component Br-empacilfide inhibits enzymes that damage the lining of human cells, thereby preventing arthritis. The third food is cherries, and the anthocyanins contained in cherries are said to be very helpful in preventing and relieving joint pain. Actually, several studies have shown that they help reduce chronic inflammation and pain in joints. In particular, they're said to be very helpful in reducing recurrent gout attacks that cause severe pain. The fourth food that helps joints is broccoli. According to studies, broccoli, which is rich in antioxidants such as vitamin K and sulforaphane, helps relieve arthritis and slows the progression of arthritis. Broccoli is also rich in cardamom, which helps bone formation, so it is said to be very good for bone health. The fifth food that helps joint health is green peppers. Green peppers contain twice the recommended daily intake of vitamin C, and the sixth food is nuts such as pine nuts, pistachios, and almonds, which are rich in protein, calcium, magnesium, zinc, vitamin E, alpha-linoleic acid that boosts immunity, and dietary fiber. These ingredients are said to help relieve inflammation such as rheumatoid arthritis and arthritis, as well as being effective in weight loss. The seventh is blue fish. If you eat salmon, tuna, and mackerel that are not omega-3 at least twice a week, you can see good effects in preventing inflammation of rheumatoid arthritis, preventing joint damage, and relieving pain and stiffness in the joints. The eighth food is bananas. Bananas are rich in potassium and vitamin C, making them effective in preventing and treating arthritis. The ninth is soybean foods such as tofu, which are rich in vitamin E and calcium, protecting the cardiovascular system and strengthening bones. The 10th is green tea. Green tea, which is rich in antioxidants, is effective in preventing and relieving symptoms of arthritis. Next, let's learn about foods that are not good for arthritis. First, salt is an essential ingredient to maintain normal bodily functions. However, most people consume more salt than they need. The World Health Organization recommends a daily sodium intake of less than 2,000 milligrams. Excessive salt intake increases the sodium concentration in the blood and raises blood pressure. This causes blood vessels to gradually deteriorate without us knowing, which can cause not only deterioration of joints but also stroke, heart disease, and hypertension. The second food that is bad for joints is excessive protein intake. Protein is also an essential nutrient, but if consumed excessively, it can cause calcium loss and adversely affect joint health. The third food is coffee. Moderate coffee consumption is okay, but if consumed too much, caffeine can actually alter calcium absorption. The last food that is bad for joints is alcohol. Alcohol contains ingredients that weaken bones, and alcohol with a high alcohol content in particular is said to have a negative effect on joints, so abstaining from alcohol is helpful for joint health. Today, we learned about foods that are good for joints and foods to avoid. Was today's content helpful? Don't forget to subscribe, like, and turn on notifications. I'll be back next time with more helpful content from Korean health management experts. Thank you for watching.